This is Mandy on the table. She's a physical therapist in Arizona, and we're presenting a workshop on the lumbopelvic hip complex. And she has quite a bit of freeway space there, hyperlordotic, and I can easily slide my hand underneath with only minimal alteration, right? Mm-hmm. Okay. And this is congruent with reduced passive accessory motion through the pelvis. I'm really not able to take up any slack and not able to create any spring mobility through the pelvis here. Whereas if we got someone else on the table, you would see us able to, just like on the rib cage, take up some slack and then spring and appreciate some recoil. So anyway, there is no posterior rotational mobility. If we do the opposite test, it would take you further into that pattern. You actually have spring mobility. I can see your whole foot and ankle move. The motion translates through that structure. Would you line your stomach, please? Sacrum looks somewhat prominent, at least lower sacrum. And I'm going to spring the upper S1 level. I can take up some slack, and yes, I can get some spring mobility through that, and I'm not sure about the camera view. Let me readjust that. Good, okay, we're good. So now I'm going to test lower sacrum. I got to make sure I'm not springing on a coccyx. All right, so backward bending spring is absent, okay? Superior spring would take you further into the pattern, and I can take up some slack there, and yes, I can induce some passive spring. On an inferior spring test, on the left, I cannot take up the slack, and I'm adding more force and I can't spring it. Inferior glide of the sacrum, not present. And I would expect L5 to be stuck in extension, such that it's near end range and it wouldn't have spring. If I come up to 4, I can take up some slack and spring it. And that pattern is consistent throughout the rest of your T-spine. All right? So I want to treat this and then refilm afterwards. Would you line your back and let me look at the upper cervical? Typically, the place where the body compensates for this is with upper cervical hyperextension. You don't have a sulcus coming off the mastoid, so I encounter the transverse tubercle of C1. If I try and side glide it, there isn't much give. Same thing left to right. If I spring on the mastoid on the right, very restricted, same on the left. If I try and spring anteriorly at C1, nope. At C1, that big tubercle, midline, spinous process, free mobility. If I try and traction your head, and you're young, healthy, and you should have mobility here, but you don't. I'm not able to create traction when the force is here, isolating the upper two joints. On the back of your head, yes. Yes, C2 to 3 and below does move, but OA C1 is very, very restricted. Are you aware of this restriction? Okay. Are you aware of the lower? You do have some symptoms on the right side, and you find that you have to treat it daily.
Yes.
So anyway, we'll stop filming and we'll treat you and then re-screen the mobility. Thanks very much.